So we're going to talk about a number of things, but one of the things that, of course, is on everybody's mind, and you two spend, my guess is, we'll talk about that, most of your days dealing with it, is COVID-19 and the pandemic that we're facing. And we're going to talk about some of the specific issues that you faced along the way and that you continue to face. But if you don't mind, I'd like for you to give us all kind of a current assessment of where we are, where as we sit here today on this at this noon hour in August. And Judge, I'll start with you. Why don't you give us your current assessment?
Thank you so much, Senator. And I struggle to call you Dean. I'm afraid it may upset Senator Whitmire. And so
we don't want to do that. So just don't call me a bad name and I'll be happy.
All right. But it's just so wonderful to be part of this, and I appreciate your leadership in shaping the school's public policy. I can't think of a better person to prepare the future generation of public policy leaders, a mayor, a senator, cancer survivor. I mean, it's just, thank you for including me in this, and thank you for what you're doing. And Mayor Turner, just always wonderful to share the stage with you.
Thank you.
Not delivering bad news. So it's just a joy to be able to share some time with you. And I appreciate your partnership through all of this and how well we've been able to work together and our teams have been able to work together.
Thank you, Judge.
In terms of where we are with COVID, you know, it's a moment, a very, very important moment, a bit of a crossroads and a bit of deja vu, honestly, because things are starting to look somewhat better. You know, where our positivity rate was around 25%, up to 25% about a few weeks ago, now it's nearing 15, where our hospitalizations for COVID were incredibly high, the highest we've seen them since the beginning of the pandemic. They've decreased a little bit. Of course, our cases still incredibly higher case counts. Today in Harris County, we had over 400 cases. I don't know about the city of Houston, but roughly we've been averaging about 1,000 every day. Deaths still very high. And so we're at a point where we have some good news, still enough bad news, still high enough hospitalizations that we can't afford to give up early. We can't afford to convince ourselves that the fight is over, because we did that before. We did that in April, turning into May, and having given up early meant that today we're not in a position to open schools safely, for example, that our economy has been bouncing between open and shut because we don't have a sustainable long-term new normal, a sustainable long-term recovery. And the way we do that is by looking at the numbers straight in the face and recognizing that this is all in our hands. If we continue to work together, those numbers will come down to a level where it's safe to have somewhat of a new normal, some version of schools back in. And that's what I'm looking forward to, is some glimmer of hope, still a lot of challenges, and a call to action for us to continue working together. At the county, we have a threat level system. Right now it's still at red, the highest it can be. And it relies on the trends, the hospitalization trends, the case trends, which are looking relatively better. The percentage of the ICU and general population that is COVID positive, the positivity rate, and the availability of countermeasures. And all of that, really, except for the latter, it's all in the hands of every individual in this community. And so that's really the big message, is let's continue to work together to bring those numbers down.
Mayor Turner, how would you assess where we are?
And I think, and let me just start off also, Senator and Dean, you know, it's good to be with you again. And in this venue, you know, I certainly enjoyed my time working with you in the legislature, and I look forward to working with you very closely as Dean of the hybrid school. And I agree with the judge. I don't think they could have picked a better person. So thank you.
Thank both of you.
And then the judge and I have been together, you know, quite often prior to the pandemic. I mean, on weather-related matters, we've stood together side by side, and now we find ourselves in something that no one would have predicted would have been the case. It's like a hurricane that won't go away. so Judge, let me thank you for your courageous and brave and leadership, and just for the focus on the details, and keeping everyone focused. So thank you, for your leadership, and I've enjoyed working with you. Look forward to continuing to work with you as we move forward. Maybe I would kind of, without repeating everything that the judge said, I would say to you, it's like a hurricane that has not left us. And generally speaking, the hurricane comes and goes, let's say about 5 to 7 days, and then you're on the recovery side. But this is one of those storms, if you will, that has just not left the shore. I mean, it hadn't left the premises. The numbers in the hospital, like Judge Hidalgo said, the numbers, if you go by the numbers in the hospitals, they're looking better. But again, in May, they look real good as well. But there's still a lot of spread in the community. This virus is still very much in our communities. We are still reporting numbers, on average 400, 450 a day in terms of people who have tested positive and been reported. Too many people dying still that we're reporting on a daily basis. To give you an example, I guess in May, when we looked at the city of Houston's numbers, in May, we reported roughly 3,700 people who tested positive in the entire month of May. In June, that number was more than 13,000. In July, that number was more than 22,000. And then in terms of the number of people who died as a result of COVID-19, in June, we were reporting like 93. In July, that number was like 250. As where we are today, that number is a little over 190, okay? And the impact on communities of color, people of color, has been disproportional. And specifically the impact on Hispanics, even more disproportional. And so we are seeing signs that it's starting to slow down. The dissemination of the virus has started to slow down, but there is still a lot of community spread. And the concern is, for example, that if people don't remain focused, if they don't continue to put on their, their masks and engage in social distancing and avoid large crowds, that we can easily move and it can go up again. So we're on a roller coaster ride, and right now in the city of Houston, as well as the county, it's like we're coming down on this roller coaster ride. The question is, will we continue to remain vigilant so that we don't start going back up? So that's where we are. We're not where we need to be yet, but the numbers are looking a little bit better when you reflect on June and July.
So let me ask you, both of you, a follow-up question to that, particularly because both of you seem well-versed in the numbers, and obviously you're focusing on data. When you look on social media and you hear from, or you read what other people are saying and how they interpret numbers, I think it'd be helpful to understand how do you get the information that you're relying upon as the mayor of the largest city in Texas and soon to be the largest city in America, and as the county judge and the emergency administrator for the county, and I'll ask you about that in a second, Judge, but for such a large county, what information do you look for? Where do you go to get it? And how do you process it as you make your decisions? Mayor?
And we get it from several different sources. The city of Houston has, of course, its health department. Dr. David Purse is the city's medical doctor. And so he's here every single day, working with us. And he works directly with Director Stephen Williams, who's over the city of Houston's public health department. And then they've got their teams, and they are crunching out these numbers every single day. Okay, and there are a number of them who are singularly focused on this. And so they're providing me numbers every single day. So that's coming from the city of Houston. At the same time, I appreciate our collaboration with the county, with Judge Hidalgo and Dr. Shaw and their teams. And so we work very closely together. The reality is, if you're in the city, you're in the county. And so we work very closely together. A third source of information we receive, we get the data from the Texas Medical Center every single morning. And they provide us with the data within their hospitals covering a 9-county area. And so that's helpful information. And then from a fourth source, we may turn to some additional sources, outside of the city, the county, or the Texas Medical Center, people who are doing their own studies or analysis of the numbers in the city of Houston and or Harris County.
Judge, what would you add to that? Or if
Yeah,
any?
similar, collaboration and making sure that we keep that collaboration, that communication across city and county. The data that we look at most consistently, particularly for our threat level system, is all on readyharris.org, and so folks can check it out there. And that is based off of data from the Department of State Health Services, CETRAC, the Regional Advisory Board that collects hospital information. Of course, we have it just for Harris County, constantly in touch. And, there's conversations that go on consistently between city, county, the local hospital leaders, and other key stakeholders. And then we have a great relationship with Rice University and some researchers who help us look at best practices all over the world. So that's something that has been so different about this pandemic, but in many ways uniting, is the fact that all of us throughout the country, throughout the world, are facing similar issues. And some folks, in a way, can see the future, have been there when the disease burden was farther along than ours was. And so I have a lot of conversations with colleagues, particularly around the country, public health leaders around the country, to try and iterate. There is no playbook for this. Particularly one area where all of us are challenged is contact tracing, for example. We all built these massive operations. We know right now that in our area, there are way too many cases for us to successfully trace and contain. That's one of the reasons we've got to bring the caseload down. But we have to figure out, how do we evaluate the success of a contact tracing program once the caseload is low enough that, it can be effective. And that, for example, has been a very vexing question for leaders all throughout the country. And even as we look at other countries, is how do you evaluate the success of such a program? There's just so many fascinating questions that would be, only fascinating if it weren't for the fact that we're living this, and we need answers.
As you were answering or saying that about contact tracing being such a vexing issue and problem, one of the listeners has put up a question, and I'll ask that question of you, and ask the mayor. That sounds like a vexing and difficult problem from a particularly governing standpoint. What has been the greatest challenge? That's the question that one of our viewers had, is what's the greatest challenge? Is that the greatest challenge, or has it been something else, or a combination of things? Judge?
Yeah, where to start?
Yeah.
Good question. Frankly, I think the mixed messages, I think every community around the world has the conspiracy theorists and has the folks that are just not gonna play along, are just not gonna be part of the solution, and that's all right. But when sort of counterfactuals and mixed messages are coming from the highest levels of government, it makes it very difficult. We had a beautiful example of unity back in March and April when we saw what happened in other states, and we said we have to take action sooner. And Mayor Turner and I were there on the rodeo, on the restaurant order, on the stay home order, and we knew we had to do it sooner, because if we waited, we were going to end up in the same position everybody else was in. And the community did their part, and it was just so powerful. And then things began to get political and mixed messages around the time of the face covering order. And immediately, you know, you see the impact on public health outcomes. So that's something that, you know, I continue to find a challenge. Ultimately, we're all putting out this fire. Whatever side of the aisle we're in, we're putting out the fire together. Harris County has 34 cities, unincorporated areas, Democrats, Republicans, and it has been a struggle. It continues to be a struggle to keep that consistent messaging, to keep that collaboration, to say, hey, wait a minute, let's put the politics aside until it comes time to run for re-election. And it's hard, you know, an important election year. But I think that that's been not only perhaps one of the biggest challenges, if not the biggest challenge, but certainly a very sad thing. It's a very sad part of this response, but nothing that is insurmountable. And so that's why we've kept focusing on trying to have consistent messaging, on focusing the guidance on the numbers. You know, I get calls from a lot of people that say, well, yeah, this is what the numbers are saying, we have to bring them way down, but the politics, and I'm like, yo, we don't need to balance the science, the numbers with the politics. We just need to look at the numbers. And so that's something that we need to remind everybody consistently. And I would say that's probably been one of the biggest challenges.
Okay. Mayor Turner, how about you? What do you see as the greatest challenge that you faced?
You know, anytime you're dealing with a potential storm, crisis, especially when you see one about to take place, you want to make sure that you do everything you can to prepare people for what's on the horizon. You know, when we face, for example, the tax day flood in 2016, Harvey in 2017, you know, it's the preparation starts before, and then you need people to respond to the situation before and during the crisis. What brings about the greatest degree of response is making sure that we, the people that they are looking to for the information, provide credible information in as much real time as possible. And like Judge said, it is important for the messaging to be consistent by all of the jurisdictions, and because people they are wanting that information, and then they will respond accordingly. And that's what I saw, for example, leading up to Hurricane Harvey. People responded. We told people to stand down. We told people not to get on the road, and the messaging was consistent and credible. And then even during the storm, while you're in it, you need that maximum degree of response. So the information that you provide has to be credible, and the message has to be clear and concise. And you have to give people, you have to provide it over and over and over and over again. And people literally are waiting to get it. What has been difficult in this crisis, albeit not a hurricane or a tropical storm, but it's a crisis nonetheless, with even with a greater impact. Okay, and when the information is from the federal level, state level, local level, when the information is conflicting, then people have a hard time trying to decipher, okay, what should I believe? And then there's a tendency, and this, I think it's just human nature, for people to grab the information that they want to believe anyway, okay? So everyone, it's just important for everyone to be on the same page, providing the same credible information and the messaging being the same. It has been very difficult at the very beginning. Let's say, for example, in March and April, we had that sort of consistency in that information, and we were moving in the same direction, especially on the local level, okay? And people were responding. But what has happened is that the duration of this crisis has far outlasted a hurricane. And that is what has made it difficult. It's one thing to get people to comply or to respond based on what you're asking for 2-3 weeks, maybe a month or two. But when you get past 2 months, That's when the leadership really has to make sure that we're on the same page, because you're asking people to go over and above what they are used to. And if there is inconsistency, it becomes difficult. So that's been one. Then the preparation, making sure you have the PPEs, the testing, getting that started haphazardly, not as uniform as it needed to have been. That created a problem. Then the tracing. So that's has not been, the information has not been as credible coming from all levels. The consistency, I agree, conflict in messaging, and then people politicizing how we deal with the situation.
Maybe the last question on COVID, unless it plays into some of the other stuff, but Judge Hidalgo, what do you want to see? What do you need to see before you would take a deep breath and say, we're headed into, it may be a new normal, but it's, but we're stabilizing in some way as we listen to these numbers and this data? What are the kinds of things that you're going to be looking for?
So we have our thresholds that we laid out back in June, and we sort of refreshed one small piece of it to put positivity rate on there. But basically, what it says, to move down to orange, we need to see a 14-day decreasing trend in our hospitalizations and our cases, and that's happening. And all of this is based on best practices. I mean, this is what they've done from, France and Italy to New York to Israel, right? I mean, it's not a mystery what kind of issues, what kind of metrics you look at. One of the challenges is folks pick one, right? They look at cases, and then once cases start looking bad, then they look at hospitalizations. When hospitalizations looks bad, then they look at positivity, right? They don't like positivity, now they go look at R naught, so you got to focus on the landscape. So our landscape has remained the same. First is this decreasing trend, that one's looking good. Then it's the percentage of the hospital population that is COVID positive. That one should be 15%. Positivity rate helps us look at the success of our testing program. We don't know who all is getting tested. It's not a random sample, and we're working on that, some way to do what we're calling surveillance testing, some way to really have a sense of the prevalence of the disease in the community. And but positivity rate does tell us, if you have a high one, then the folks are getting tested probably are the folks who have symptoms. And so you're not catching a lot of the folks who may be asymptomatic spreading the virus in the community. So we want to see that positivity rate down to 5%. And that is what, everybody from the CDC to the World Health Organization, everybody sort of agrees that 5% is very important. So that's the one we've added to measure the success of our public health interventions, which we had before as public health interventions, but we didn't have a specific number. And then where we'll really breathe easy is the final one, which is the widespread availability of countermeasures, a vaccine, a treatment that's
Sure.
widely available. So the first three, what I mentioned, that will bring us to orange. That will still be, quite high numbers, but it'll be a little bit better. We can open schools somewhat, we're saying to 25% or 500 students with certain parameters. We keep going down from there. We can go to yellow, a lot better. And then green will be when we do have those countermeasures. Until we have a widely available vaccine or treatment, we will have to be in a new normal type of situation. And when you look at our states, it's a fascinating a case study in a way. You look at the different states throughout our country, and they have the rise in the hospitalizations, but the ones that reopened later and reopened fewer things at each stage and waited to reopen until the curve came to 10-20% of peak are the ones that are being able to have a consistent new normal. Now, when you look around the world, there are some communities that they made it to that point where we gave up early. They kept going, but then they opened everything all at once. They let things go to 100%. They let bars open, schools open, and so now they're having to backtrack. So that's another key lesson, is once we make it to those thresholds, we have to remember it's a new normal until we have those vaccine treatments widely available. So that's what it is looking, not putting an arbitrary date, because the virus isn't going to obey an arbitrary date, but picking some metrics. And it's very challenging, particularly on the topic of schools, where folks are saying, well, we're still a ways away from those numbers looking good. And so but we really need the kids in school. I mean, the mental health and the CPS calls. And I'm like, you know, I feel it. Our big project this year was supposed to be early childhood education and mental health. Those were supposed to be in juvenile justice, our big projects this year that got sidelined by COVID. But we can't put ourselves in a position to fail. And these numbers are not intractable. They're completely in our hands. We can bring those numbers down. And that's where it goes back to, you know, that consistent messaging, all of us working together. We've pulled out all the stops. I mean, you guys have gotten the alerts on the cell phone. We've done the alerts on the broadcast media, the radio. I mean, all the emergency communications that can exist, we've used them, and hopefully that's made a difference going to red, but we gotta keep pushing.
Mayor, you want to add anything about what you're looking for on that? And I want to ask you about how this impacts upcoming elections and voting.
Well, what the point that I thought I will add though is, if I can go back to one of the stumbling blocks that we face, and that is when we're dealing with these type of crises, somebody has to have the plan, okay, and somebody has to call the play, and then the rest of us will have to run it. And what I mean by that, Dean, is that, you know, this is a global situation, global crisis. There should have been a federal plan in place. Okay, it doesn't mean that it's everybody is doing the exact same thing, but there has to be a plan where you take into account these are the things that people can look to and can act accordingly. And then in the absence of a federal plan, then the question is, who then devises the plan? And let me just go back to just like with hurricanes, that plan is pretty much designed by the locals, you know, the county and the city. In every crisis in which we have faced, at least since I've been mayor, it's the local governments who have designed the plan and then asked everyone to move forward. So you have, you know, so you know who's calling it and you can hold responsible. What has made this very difficult is that we started that way in March and April with the local officials calling the play, okay? And then the state came in afterwards and put in place a statewide, so to speak, stay at home, if you want to describe it as such. But then after that, after the end of April, then the tools that the locals have, those tools were taken away, okay? And then you had somebody else calling the play, okay? And then the situation kind of gets out of hand, out of control. And so when you don't have a clear understanding on who's putting in place the plan, who's calling the play, it's very, very difficult to handle a situation of this kind. And that has made this situation even worse because people then are confused on who do you hold accountable? You know, who's responsible? Is it the Fed? Is it the state? Is it the governor? Is it the county judge and the mayor? I mean, who's who? Okay, and that has made this situation far worse than previous situations of this magnitude. And it was needed even more here because this is something that we had not been a part of.
Yeah.
But I don't care what the crisis is, there are certain dynamics that remain the same.
Well, let's talk about how this impacts what we got coming up. As both of y'all know, Texas is going to allow absentee voting for the following folks. If you're 65 years or older, disabled, you're going to be out of the county on election day and during the period for early voting by personal appearance, or confined in jail but otherwise eligible to vote. We saw a big uptick in absentee voting in Harris County during the fairly recent July primary runoff election. That trend is really expected to continue into the general election. I'll start with you, Mayor, but what do you think we can expect of the election experience when we start early voting in October and run up to November election day?
I think there's going to be a strong desire by a lot of people to vote, to participate in this election cycle.
Artist, dare you.
I think there's going to be a strong desire by people to participate in this election process. I think more people are going to want to participate. They're going to want to cast their ballot in this election cycle. And quite frankly, when we're dealing with the crisis of this time, you want to make it even make it even more possible for people.
Yeah, I know. I thought about talking to you about it.
Hang on, we've got some background here.
Yeah.
No, it sounds like there's a background that I'm not sure
The billboard campaign.
what it is.
I don't know where that's.
I
Okay.
don't either.
Go
Go ahead, sorry.
Those were people who were agreeing with what I was saying, that
Exactly. Exactly.
a lot of people were on vote. So, I support people being able to vote by mail. Okay, look, there are many people who are scared. Okay, we've told people to stay home. We've told people to avoid large gatherings. We've told them to wash their hands, to use sanitizer. We've told them to put on their masks, to engage in social distancing. So this is one of those times that I strongly believe that people ought to have the right to vote by mail, and not just absentee. Not if you're 65, disabled, you're going to be out of the county, or you are eligible, but you find yourself in jail. But this is a unique experience that this country hasn't faced in the last 100 years, and it is just a fundamental right for people to be able to vote. It's just fundamental. Instead of making it more restrictive, we need to be making it more available for people, and make sure that we do everything we can to just have a sound election process.
Thanks. Judge Hidalgo, how do you see the upcoming election process as part of the COVID pandemic? And let me ask you, if you had the resources and could remove restrictions, make them different, what would you advocate for?
Yeah, and I think I do want to pick up on a point that Mayor Turner made earlier, which I thought was very important about the plan. And we're talking about elections, and then that's part of it. But for COVID, Mayor, I just thought that was so valid, that we had a plan. The state had a plan. Currently, no plan, right? That's where we've tried to step in and say, here's a plan for schools, here's a plan for the threat levels, because otherwise, I mean, that's what government's supposed to do. So I just wanted to elevate that comment. I thought it was very important. In terms of voting, we've come a long way. We still have a ways to go. Just a couple of years ago on election day, folks had to rush back from work or picking up the kids or whatever it was and make it back to their home precinct to cast their vote before 7 o'clock. And I saw myself, I'm sure all of us did, folks who were just sprinting to get there, finally make it to the line. Sorry, it's 7:01, it's 7:02, you get turned away, you can't vote. And so that's something that Dr. Troutman implemented here with the support of Commissioner's Court before she retired, and it's just a fantastic legacy, is to be able to vote at any polling location on election day. Now, with the runoff election, Clerk Hollins came in, and already fantastic changes, drive-through voting, for example, which doesn't need to happen only during a pandemic. It's something that should take place and does take place elsewhere. And now we have it in Harris County. You can basically show up. The best thing I can compare it to is like a Sonic drive-through. The location is solely for voting from your car. You get the machine, which is a sort of portable version of the voting machine we're all used to, and can vote that way. It moves much faster, much faster than voting in person, and we'll have a lot more of those here in the November election. Many more voting locations, both for the election day voting and early voting, extended hours, 10 o'clock. We're working on a 24-hour polling location. And yes, we're working on new voting machines the process couldn't be done through procurement and everything quickly enough for the November election, but certainly it's something that's coming soon after that. So it's about just removing those barriers. We learned that in Harris County, the voting eligible population has increased by a certain rate. And yet the number of people registered to vote has been fewer, has increased by less. So if you look at it, you say, well, there's been an increase in the people registered, you would think that's good news, but truly it's not, because it hasn't kept up with the pace of who all is eligible even. I mean, really, we should be surpassing that. And so that's how we're looking at now, what we're looking at now in terms of registration. We just created also the Office of Elections Administrator in Harris County. So it will be a nonpartisan person to both focus on registering voters and administering elections. That is what every other large county does in Texas, I think, except for Dallas. There's one that doesn't do it. But anyway, the ACLU, the Texas Civil Rights Project, the voting rights people, they all are, you know, the academics. We had Bob Stein from Rice University look at this, and basically when you study it and you study the country and you study the outcomes, the results are much better when you have this nonpartisan person on the election side of the duties. So that's something that's coming, and we're working on finding that person. So a lot of changes to make voting accessible. In terms of vote by mail, one that I may have missed, Senator, when we were trying to fix the audio here, is the disability also is something that qualifies you to vote by mail. The Texas Supreme Court said that your fear of contracting COVID is not in and of itself a disability that will qualify. But if you have a condition that may be exacerbated by the virus, that combined with the fear is enough. And so it's making sure that voters know that. In the runoff election, we sent a mail-in ballot application to every person over 65 so that they could apply since they qualified. In this election, we want to make sure that everybody knows what it is that leads you to qualify to vote by mail so they could take advantage of it. And seeing as the state is not allowing universal mail-in voting, then it is about making the in-person voting experience as safe as humanly possible. So folks who voted in the runoff have seen it, finger cots, face coverings, plexiglass, everybody gets a sanitizing wipe, social distancing, again, the availability of curbside voting, so drive-through voting, just pulling out truly all the stops, looking at all the best practices. We need this election to be safe. We need this election to be secure, and we need it to be accessible. We are the third largest county in the country. No matter how people vote, we need people to make their voice heard, because it's an important election, not just for the country, for Texas, and we're a big part of that. So I take that part of the job very, very seriously, and very proud of the work that both Clerk Troutman and Clerk Hollins have been doing.
Great. So we're at about 15 minutes to the end, and so I'm going to take a couple of questions from our interactive aspect of this, and ask y'all about some things. For example, Hurricane Harvey has been mentioned a couple of times, and so there have been a couple of questions. I'm going to combine a couple of questions and get your answers to this. Mayor, I'll start with you. We're 3 years after Hurricane Harvey. And so I would ask you, how do you rate our disaster preparedness right now? You know, strengths and weaknesses. And the question that was asked is a question about, you are having to deal with COVID the way it does, has it weakened our ability to be prepared for a disaster like a hurricane?
I don't think it has weakened our ability. This is an area that has been battle tested. I mean, look, and each storm, each crisis is different. We learned from the Tax Day flood in 2016, areas that were not where we needed to really focus. Let's say like on the north side, a lot of the apartment units, for example, were in floodplain areas. And so the next time we wanted to make sure that we had shelter located all throughout, for example, the city, and that we were ready to go even before the rain actually hit or the storm hit. And so we learned from the tax day flood. We implemented some of those changes. And then in Harvey, that's the more rain fell on this city than any city in the country's history. And so we learned from that. We needed more high water equipment. And so we've ramped up quite a bit from Hurricane Harvey. And then we have now even more shelters identified, pre-prepared. And then we've been working to make our area more resilient. And working in collaboration with the county. Appreciate the voters approving the $2.5 billion for the county bonds proposals. Many of those projects are already in place. Project Braze, for example, is much further along than it was prior to Harvey. And there are a number of other projects. We've changed our ordinance where we are having people are having to build higher, above the 100 or the 500-year floodplain. So there are a number of changes that we've put in place. We have much more equipment. There's a squad, about 70 persons within the fire department that's more prepared to respond for high water rescues. So we're in a better place. Now COVID-19, for example, has added another dimension. And so it's not just about getting preparing in your hurricane kit, your medicine and your flashlights and batteries and things of that nature. Now you have to make sure that you're putting masks and sanitizer and some other things as a part of that hurricane preparedness kit. But this is an area that's been very well battle tested. I think we are more prepared now than we were in 2019, but we're still not as prepared as we need to be, if that makes sense. So more prepared than we were in Harvey. But at the same time, until many of these projects, detention projects, flood mitigation projects are completed, we won't be as prepared as we need to be. And that's why it's important for people to be weather alert and to make sure that they're following the information and the instructions that we provide.
Judge, let me ask you kind of a corollary question that has been brought up by some of the folks that have tuned in. And that's related to, and the mayor's touched on it in that answer as well, about hurricane or disaster preparedness. And that is the perennial issue of flooding. One person has talked about how Harris County is standing up the Harris County Community Flood Resilience Task Force to develop the 2050 flood resilience plan. So I've got really kind of a two-part question for you. One is, how are you working with the city on that so that will be cooperative and working together? And comment, if you would, on what you see the biggest challenges with regard to our flood resilience.
That's another, huge multifaceted challenge. To give folks an example, we're trying to look at the whole picture, the projects, but also preserving green spaces, buying out areas that we know no matter what flood control project we do are always going to flood. But if you do buyouts, you've got to move people to equivalent or better housing somewhere else, and we have an affordable housing crisis in our county. And so it all ties in. It really does. So the way we're approaching it is, yes, the bond, it was a great step. That's good. In many ways, that number was just pulled out for whatever reason, $2.5 billion, but it wasn't that the need was $2.5 billion. In fact, folks have estimated the need for a truly resilient county as much higher than that from a dollar standpoint. And so what we're saying is, number one, finish those projects as quickly as humanly possible. And that we are on track. We've sped up the projects as much as possible. We've brought outside people to figure out, what can we do to do it faster? And so they're squarely on schedule. Otherwise, they would have taken longer. Drainage projects so the county does the bayous and the channels. In the municipalities, the city and the other municipalities take care of the drainage. In unincorporated areas, we as the county do the drainage. And so we looked at what are the areas that flooded during Harvey and during Imelda, not because of channels, not the riverine flooding, but because of poor drainage. And we've gone in there to fix those. What was supposed to take 5 years is taking 3. Looking at equity. we had all those bond projects in a bucket. You know, there was no order. In the past, not just in our county, but throughout the country, when there's been a disaster, there's been time to recover, nobody really knows which communities get to go first. At worst, it's, you know, of whoever has a friend downtown. At best, it's a coincidence. And so what we did is come up with a formula that we've been in touch with people from all around the country who've reached out that they want to incorporate that kind of thing. In fact, the federal government as well, they want to incorporate that kind of thing into disaster recovery. So it looks at prioritizing projects in areas where the project will get more people off the floodplain, where it has environmental benefits, where it will decrease the risk of flooding by even more, and where there's higher social vulnerability. So communities that if they flood, they don't have a second home to go to, that kind of thing. So that is all a formula, an algorithm that lists out the order in which all the projects will be completed, and that's all online. And finally, being very smart. So we enacted the most stringent detention requirements possible under the law. Anything else would have been a taking, recognizing that we need a 21st century county. People need to want to continue to come here. We need young people to want to continue to stay here. They won't do that. They won't buy homes if they're afraid they're going to flood every year, every other year, if there's not enough trails, if there's not public transportation, if they see such inequities that are tragic. So all of that goes hand in hand. And that's why, you know, these detention requirements to make sure we don't flood folks downstream as we build, that we build smart. We're remapping the entire county. The effort will be about halfway done next year. It's a huge effort, so we can really be clear with people which areas are at risk or not. And then most importantly, with this task force asking the question, what does success look like? What will it take to get there? And how do we measure progress toward that? So there is a plan that is being, you know, the beginnings of it are being worked on. Of course, we'll work with the city on it. Our flood control folks talk pretty much every day. And we say 2050, but for me, and I tell the guys, you know, everybody on the team it needs to be sooner. You know, we can have a 2050 vision, but we got to deal with this, you know, ASAP. So that's a very exciting, very big challenge. But already we've committed at least over $400 million of the bond. Those projects on schedule already lifted many homes off the floodplain. But as the mayor said, it's not enough, certainly until the projects are complete. And even then, we have a lot more work to do, but we're not afraid of the conversations. We're not afraid of the word climate change. We're not afraid of admitting that we're going to need a lot more money, because that's the way we make our community resilient, attractive, competitive. That's what we got to do.
Thank you. We're just about out of time, and I'm going to keep us on schedule. But Mayor, I want to ask you one last question related to work you're doing with regard to policing, and particularly since yesterday, the governor, lieutenant governor, and Speaker of the House held a press conference to talk about specifically to talk about policing and how that could impact local communities. And not really as a response to that, but our nation has recently, in an overdue way, as far as I'm concerned, recognized that this pain is not new, right. And that people's concerns are not new. What I hope is new is that there will be a greater effort to address that pain and frankly recognize and appreciate the anger. But that's me talking. Let me ask you, I know personally that you're working on issues related to this, and I thought I would ask you about that. Right.
And let me say, I'll hold my comments from right now on
sure.
What the governor had to say yesterday. But look, it is important for all of us to look internally at our own policing practices, policies. We can all do better, okay? And so, you know, I have already signed an executive order, for example, to make it very clear, to make it the city policy, not just the Houston Police Department's policy, but the city's policy, that when an officer, for example, sees another officer or officers doing something wrong, violating policy of the law, that you have a requirement to intervene, that make it a policy, for example, to de-escalate, not to use deadly force when practical, when you can provide a verbal warning before. And then when deadly force is used, for example, to report that. And there are a number of things. It's part of the 8 can't wait that we've now incorporated into our into an executive order that I've signed. At the same time, and that's not enough, we've put forth the task force, and I've charged them, for example, to take a look at our independent police oversight board to see what changes need to be made there to make it even more credible and more impactful. Because what people are seeking is that they want to make sure that we have accountability. And that's quite frankly, that benefits not only the citizenry, but it benefits the many of our police officers who do an outstanding job. And so accountability is good on both ends. So they're taking a look at that. And then we've called on our police officers and departments to do way more than what they should be doing. And what I mean by that, when there are homeless issues, we call on police. When there are substance, mental, behavioral health issues, we call on the police. When there's domestic violence, we call on the police. And so I've asked them to take a look, what are the better practices? What are the better practices that we can employ that can provide, that can enhance public safety even more and doesn't require our police officers to be the ones responding to way more than what they should be responding to. And so those are the type of reforms. At the same time, where we have made a mistake systemically and that is that there's many times a tendency to fund more law enforcement organizations than to invest in communities that have been underserved and under-resourced for decades, okay? And what people are seeing, and that is that we'll put more dollars into police departments. We won't invest nearly as many dollars into communities that have been underserved and under-resourced. And in many cases, these are communities of color. And so people see us using police forces to suppress and incarcerate. And what we are needing to do now, systemically, is to invest in affordable quality housing, parks and green space, quality schools, economic job business opportunities, invest in our kids, invest in these families, invest in their neighborhoods. And therefore, when you invest in these communities, you don't have to spend nearly as much time policing these communities because every neighborhood, regardless of where you live, is a neighborhood of promise and opportunity. And Kirk, I know that's the case because I grew up in one of these neighborhoods that I'm speaking about. And I still reside, even as the mayor, in these communities. And in many ways, these communities have remained the same over the decades. And the frustration and the anger have only increased. And so when there is a conflict between police and people in these communities, then it turns into a forest fire. So the reforms are not just internally within, for example, our police departments, but it's dedicating and investing in these communities that have been overlooked. Now, we have an outstanding, we can all do better, and it's important for our police officers and our community to be on the same page, on the same team, pulling in the same direction. And I think, and there's no question in my mind, we can do that. I'm proud of our police officers, but we can always do better. And it's important for people seeing us doing better and not taking forever to implement the necessary reforms that will make us better.
Thank you for that answer. Let me say thank you to both of you, Judge Hidalgo, Mayor Turner. On behalf of the folks that have tuned in and are listening, let me, and I say this on behalf of them and the people of Houston and Harris County, thank you for putting yourselves on the line the way you do in your public service. But also thank you very much for coming on the Hobby Hour and being part of this effort and also answering so candidly. For those of y'all that are listening, stick with me for just a second. We're going to put up in the chat room the next, so that everybody can see it. The next Hobby Hour is September 16th. September 16th at noon, we'll have Bob Harvey, the president and CEO of the Greater Houston Partnership, Bill McKean, the president and CEO of the Texas Medical Center, Dr. Ramanand Krishnamurti, who is the chief energy officer at the University of Houston and an expert that everybody recognizes in energy matters, and Dr. Laura Murillo, who is the Houston Hispanic Chamber of Commerce president and CEO. And we'll be talking about the economy and the shock to the energy sector and what COVID has done. I'll tell everybody that the Texas Tribune will be a co-sponsor of that hobby hour. And it'll be a part of the Texas Tribune's month-long virtual Trib Fest 20, which is going to be all online. You can register for the Trib Fest, and I hope you'll do that. And you can also go ahead and get in line to register for next month's hobby hour. Couple of things. One is that I'll be interviewing in a one-on-one moderated deal, just me and Speaker Joe Strauss, former House Speaker Joe Strauss, on Thursday, September 3rd at 8 in the morning. Thursday, September 3rd at 8 in the morning, a one-on-one with me and former Speaker Joe Strauss. I'll also let everybody know that the Elizabeth D. Rockwell Lecture Series on Ethics and Leadership, that's jointly sponsored by the University of Houston Provost's Office and the Hobby School of Public Affairs, will be hosting Bakari Sellers. He will be speaking on Thursday, September 10th. Please go to the Hobby School website, uoh.edu/hobby, and you can register for that as well. We're going to have a big announcement that night after my longtime friend Bakari Sellers gives his speech. With that, let me say thank you again to Judge Lina Hidalgo, the County Judge of Harris County, and Houston Mayor Sylvester Turner for their public service and for participating in the hobby hour. I appreciate y'all. God bless everybody. Be safe. And by the way, everybody, as both of them have told you, keep wearing that mask. Bye-bye, everybody.